Hey everybody, it's Dr. Kadisha, your board certified emergency medicine physician. Here just doing a quick Facebook Live. Thank you. Thanks everybody who's coming in. We'll just wait a few more seconds. Good evening. Good evening. I can't wait to hear your thoughts. And please hit share. Please hit share. I'm going to share to a few people. Hey, Dr. Carol. Hey, Marlene. Hey, Barbara. Thanks for coming in. Yes, do tell me your thoughts on this subject. Okay, y'all. Thanks for coming in. I know it's late, so I'll be quick. I just wanted to just do like a little preview and just let you guys know that I'm going to be doing a live stream on Sunday about NSAIDs and COVID-19. I know it sounds like a dry topic, but cold and flu season is coming, and we are certainly using NSAIDs, aka non-steroidal anti-inflammatory drugs, aka ibuprofen, Advil, naproxen, Motrin. We're going to be using all that stuff for flu season. So what did they say about COVID? What did they say about using NSAIDs with COVID again? And I'm bringing up this topic because, it's September now. If folks aren't going to school, haven't started school already, they're going soon. And, unless you have some kind of allergy or condition that prohibits you from using NSAIDs, ibuprofen and all that, folks are going to be stocking up. And what did they say we should do about using them for COVID-19? And why am I talking about this in school? Because I just want to add some perspective to this. So since the beginning of this pandemic, at least 340,000 children have tested positive for the coronavirus, representing about 9% of the United States cases. And the rise in cases was mainly fueled by states like where I live, states in the South and in the West, but also Alaska, Montana, in addition to Florida, Georgia, other places like Missouri, Oklahoma. Those cases have risen. And NPR and based on the American Academy of Pediatrics and Children's Hospital Association, noted that at least 97,000 children tested positive for the coronavirus since starting in the last 2 weeks of July, getting ready for going back to school. 97,000 children. And yes, the younger children don't get it as severely, and they don't pass it on as readily as adults do, but teenagers do. Teenagers do pass it on, so we have to be mindful of that. Now, that's the light side to it, that most children don't get critically ill, and among the reported hospitalization data, the rate for children's hospitalization is like 2%, but it's less clear as far as how effectively really these kids, especially in that gray area between very young and adolescence, how well they spread the infection to friends and classmates, teachers, and school staff. So, hey, Dr. Tanya, thanks for coming. Thank you so much for joining me. So we look forward, we look to the east. We look to the east, the people who kind of made it through. And data from South Korea says that children younger than 10 might not spread the disease easily, but the teenagers do. So that's where we're getting that data from. Teenagers spread it almost as effectively as adults do. And the CDC is, likes to refer to the cautionary tale of the Georgia sleepaway camp, where in a matter of days 260 campers and teen staffers tested positive, and the kids ages 6 to 10 had the highest infection rate. They were about 51% of those kids tested positive, and so we're relieved that they don't get it as severely, but various adults and children with comorbid conditions can be severely infected, and so affected by the infection. So I wanted to talk about whether or not about NSAIDs in general, and and whether or not we should be using this. And I know that there was a lot of fear in March about a statement that was put forth stating that ibuprofen could cause more severe illnesses, and then there were even a couple other physicians, like an internist and a nephrologist, who backed that statement. So people were afraid to take ibuprofen and things like that. But I just wanted to let you know that those studies weren't peer reviewed, that the information that they used wasn't from COVID-19 patients, and it was they were looking more at long-term use in a specific population, not the general population, not COVID-19. Well, anyway, that statement about ibuprofen being dangerous for COVID-19 was debunked. So healthcare professionals will advise ibuprofen for COVID-19 illnesses. And now that it's going to be mixed up with the flu, other coronaviruses and things like that, we've got to be you have to be comfortable with using ibuprofen for that. So I just wanted to get on here with you guys and just talk about that, and just to announce that we'll be talking about it more on Sunday, because a lot of folks don't know how to dose ibuprofen and Tylenol for their children, and they end up in the ER stating that the fever can't be controlled, and you end up coming to the ER for just to sit down with the nurse who goes over your child's the child's weight, and proper dosing instructions, and you don't want to come to the ER for that. So I just wanted to talk about what's going on with some numbers, as far as kids going back to school. Certain colleges have seen a great surge in the number of cases because the college students are having more COVID parties and just gatherings and things like that. And again, catching it just to catch it and get it over with, catching COVID-19 just to catch it and get it over with, is not a good idea. It is not an effective way of helping the community get over COVID-19. Doing it that way is not effective, and it's not safe. Even if you believe you are a healthy person, you don't know how COVID-19 is going to affect you. And now that it has been 6 months since the pandemic has, kicked in, we are seeing people who are getting infected again. There's someone who's very near and dear to me in the medical moguls. You guys might know who I'm talking about. They had it one time and now they have it again. They're back in the hospital with it again. So you can get it a second time. The immunity, you can't count on the time period. As if you've had it before, you can't say I've got 3 months immunity. You can't say that. There's no way to know. And that's why they keep throwing out the keyword novel. Novel meaning new to us. New as far as we don't know how long immunity is going to last from person to person. We don't know the severity of the course of illness given a certain individual, whether they're healthy or not, because very healthy people are passing away from this illness, as well as people with various health conditions like diabetes, lung disease, heart disease, and things like that. It's hard to say. So don't count on the parties to help spread, to spread immunity and help the community. It's not. Doing it that way is not going to help. And I know a lot of people hate vaccines, a lot of people fear vaccines, but again, getting vaccinated is the safe, effective way by which we will achieve herd immunity. And with COVID-19, for herd immunity, meaning that we can take off our masks, when 60 to 70% of us are immune to COVID-19. That's when we will be able to take off our masks and go to concerts and things like that, when 60 to 70% of us are immune. And that's not going to happen with COVID parties. That's not going to happen with not wearing your mask when you should wear a mask, or just trying to get it over with. It's going to take vaccinations to do that. And please refer to the Facebook Live that I did the other day, maybe last night or the night before, on vaccinations, because August was National Immunization Awareness Month. So I did go over some over vaccinations, and I actually did show some graphs. I showed the recommended immunization schedule for ages 0 to adult. So go to that one on my page. And also, if someone could put in the chat the link to my free PDF on how to stay well and safe during the pandemic, just go to www.drkadisha.com, www.drkadisha.com. If someone could please put that in the chat. There I took some time and effort to do a special presentation for you guys on how to stay well and safe during the pandemic. A lot of us know a lot of things, but not all of us know everything about what to do, so you could still benefit from that PDF. So thank you so much, Dr. Tanya. I really, really appreciate it. Thank you for putting that in there. So again, herd immunity, don't do the COVID parties. This ain't like the chicken pox where you get it and get it over with. There are people who are on their second infection. There are people who are still short of breath, walking to their car from the house. There are still people who are weak. There are people who have suffered stroke-like symptoms. There's a group of people who are still suffering from the long-term effects of their infections, and they are called the long haulers. Look them up online. They are the long haulers, and they are people who are still living with the effects of having their infection. And these are people who weren't necessarily hospitalized. Many of these people managed their illness at home. They managed their illness at home, but they still have long-term effects from having COVID-19. Hi, Dr. Ken. Thanks so much for coming in. Thank you so much for coming in. So, don't let your college-age kids do these COVID parties. They really cause a surge in cases. up at a New York university. Schools and universities are rolling back the in-person learning because they're seeing the surge in cases due to, just poor social distancing, kids not being able to practice the hygiene and social distancing practices that they need to practice. I know that the government was supposed to be supplying 125 million masks to the schools in order to facilitate in-person learning, but the cases are still rising. Like I said, 97,000 children turned up COVID positives starting in the last 2 weeks of July, and that's about a third of the number of children who've come down with the virus since March. So since end of July, and we're at the end of August, beginning of September, that's a month. Almost 100,000 children came down with COVID-19 in the last month trying to go back to school. So I don't know where those 125 million masks are, but while you guys are waiting for that, I do just want to stress that it would be best if you send your kids to school, if you are going to send your kids to school, with their own their own little case with the mask, like what I've created for you guys, the mini mobile MD kit. Here's one small compact one. It has a mask, sanitizer, gloves in it, and if they feel a fever coming on, they can just put the strip on their forehead and see what their temperature is. So I've got this size, and I have this size and design also. So I know certain of us might like this size, certain of us might like this size, but they go in all your backpacks, lunch boxes, things like that. And I also have masks with valves in them, so it's easier to breathe out. Now I know the CDC says that these don't protect other people outside of the wearer from COVID-19, but you can put a surgical mask, which is in here. You see the blue in there? That's a surgical mask. You can put it on top, or I personally like to wear the surgical mask underneath and put this mask on top. And so I've got them in all these colors. This is like blue, purple, I've got red, camouflage, and black, and I've got them with valves or without valves, so that we can all have our own personal kits when we're going to school, going to the grocery store, going to work, getting on the bus, things like that. That is how, while we're waiting for this vaccine, and I know a lot of y'all don't want to take the vaccine, so what else are you going to do? You got to stay safe, and you have to practice these methods. And I tried to get all the colors that people like: blue, red, purple, black, camo. So you can get my free PDF at www.drkadisha.com, and you can also get the kits there as well, because we can't rely on the government. We can't wait and hope and hope people will be fair as far as distributing things. We have to have our own kits until this vaccine comes, and then we can fight about who's taking the vaccine and who's not going to take the vaccine and all that. But so yes, join me Sunday. You'll see the post where we talk about NSAIDs as we go into cold, flu, and coronavirus season, because from what I'm seeing in the ER, a lot of y'all don't know how to dose Tylenol and ibuprofen for your kids to get these fevers down. And then I hate it when you come in and the only concern was getting the fever down, just for you to find out that you weren't dosing your ibuprofen or Tylenol properly. So I'm Dr. Kadisha. Follow me here. Please hit like, please hit share. This page is about safety and common sense and staying out of the ER unless you absolutely have to be in the ER. This comes from an ER physician with 20 years experience, 20 years in the game. So follow me on Instagram, go to drkadisha.com, get that information, get your kit. And I also put out information every week on COVID or on whatever information is being, whatever health topic is being observed for the month. So like September is Suicide Prevention Month. That information will be coming out next week. I'll be doing a write-up on that next week. This week, I forget what blog I put out this week, but and it's not dry. There's lots of pictures and everything on the blog, so it's not just all text. There's pictures. I try to make it large print, easy to read. So yeah, join my list, join me so you can get that information. You can get daily affirmations so that we can keep each other, in a positive place, as positive as possible while we get through this together. And again, drkadisha.com, drkadisha.com, and join me here Sunday as we discuss cold and flu season, whether or not it is safe to take ibuprofen for COVID, and how to properly dose Tylenol and Motrin. Can you take it together, when to take it, things like that. So thank you so much for joining me. Do comment, hit share, hit like. Definitely share this information. Share it with people who have small children. Share it with people who have children who are going to school. And I will see you all on Sunday. Get your kits, get safe, get your ibuprofen, your Tylenol, and I will talk to you on Sunday. Bye.